Hello, my name is Hwii Go, working in Yeongnam University Hospital located in Daegu City, South Korea. I really appreciate for your warm interest for my article, which was recently published in the ICUrology, entitled with the influence of repeated PSA screening on the treatment pattern in a country with a limited social perception on the prostate cancer. I'd like to explain some background and the key numbers of this study. As you know, there has long been debate over the actual benefit of PSA screening, which was generated by the conflicted outcomes from the US data and the European data. The PSA data, which was generated in the US, failed to demonstrate any substantial benefit in overall survival in comparison with the control groups. At the same time, ERSPC or Better trials, both of them was European study, shows some benefit in overall survival. But since 2012, US Preventive Service Task Force do not recommend the use of PSA screening for the mass population. And their recommendation affect a lot of international and local guidelines on the detection of the prostate cancer. Meanwhile, most of Asian countries, including Korea, experienced the increase of PSA screening, PSA prostate cancer. For example, in millennium, the prostate cancer was just the 10th most common male malignancy in Korean males. However, after a couple of decades ago, in 2018, the most recent data reported that the prostate cancer now became third most common male cancer among the Korean males. Because of this rapidly growing, the social perception or the knowledge on the prostate cancer or PSA screening remains quite low without any political support in performing PSA screening. That is the background for this particular study. So we investigated the number of repeated PSA screening among the whole patient with prostate cancer. For this purpose, we obtained the data from the Korean Cancer Registry, including NHIS, which was performed from 2008 through 2016. And we defined the repeated PSA screening as at least 3 PSA tests during minimum 2 years before registration into this cancer registry. And the non-screening group was conditionally defined as the first PSA test was performed within 3 months before registration. And this is the outcome. During these 9 years, over 73,000 of the men with prostate cancer was identified in the South Korea, but only 27.7% met the criteria of repeated PSA screening. In terms of treatment pattern, these two graphs shows the instance of a local therapy, including radical prostatectomy in the left column, including roboticsone, and the right column demonstrated the instance of radiation therapy. As you can see here, there is great difference between PSA screened group and the PSA non-screened groups. And you can see the PSA screened groups have a more opportunity of a local therapy than the PSA non-screening group. And in the PSA screening group, fewer patients underwent systemic therapy, including chemotherapy or hormonal therapy, with the difference of 13%. We also did multivariable analysis on the overall survivors, and along with the age, location, and the income status, the PSA screening status affect on the survivors, and non-screening group have a 2-fold higher mortality rate. Because the limitation of contemporary NHIS system, we do not do further analysis, so like cancer-specific survivors or quality of life outcomes. But we believe that these outcomes support additional evidence on the PSA screening for the mass populations. I hope this study encouraged you And I really appreciate for your warm interest for this article. Thank you.